Grabe, ang init ngayong araw na to. Kakaligo ko lang pero pawis na ako. Gusto ko sanang maligo ng dagat eh. Swimming pool. Kaso pandemic ngayon eh. Nakakainis naman. Oh, kayo pala yan. Kamusta na? Ano bang meron ngayon? Alam ko na. Gusto niyong matuto, no? O siya, sige. Tayo magsimula na. Pero wait. There's something nakalimutan ako. Hindi pa pala ako nagpapakilala. Saka di ba ako nakapag-biso? Sige, wait ha. At may gagawin ako.
Say what I want, say what they want you to say. Like I can pretend that I don't wanna and I'm afraid. Wishful drinking, tell myself that I'm not thinking about.
So, ayan, nakapag-bis na ako, diba? Ang bilis lang. So, my name is Jewel Amelar D4. Jewel pa? Joel naman talaga. Baklang
I am first year college taking of BS Medical Technology in ICCT Colleges Foundation Incorporated. So, I am future RMT. Charot! Baka, pala rin ako. Pray lang. So, ano ba pag-uusapan natin ngayon? Ano nga ba? So, today I will going to show you about the rule of being medical technologies. So, ano ba yung mga rules ng mga medical technologies? Pero bago muna ang lahat, alamin muna natin kung ano ang medical technologies. Medical technologies, also known as clinical laboratory scientists, sila yung mga tao kung saan they are highly skilled health professionals regarding to getting bloods, analyzing urine, and other body fluids in our body. Ang medical technologies din, mga Dai and Dong, they are professionals regarding to testing and operating the medical equipment that is used to analyzing specimens in our body and ensuring that the tests are completed in a correct and timely manner. So ano pa nga ba ang mga rules ng medical technologies o mga karaniwan nilang ginagawa? So marami naman silang ginagawa katulad lang ng getting bloods, analyzing the urine, pero ang ipapakita ko lang po sa inyo is the Venipuncture test or process. So, ready na ba kayo? As in, ready na. Well, lapit nga. Lapit pa. As in, lapit. Kunti pa. O, diba? Ang sarap ko.
君の虜になってしまえばきっとこの夏は充実するのモード噂の Dreaming Up 忘れないで
Here we go again mga Dong and Dai. This is the step-by-step or guide to perform venipuncture or draw blood. The step 1 is gather the equipment. Gather the necessary equipment and tools used to perform the blood draw and place them on a tray that easy to get. Typically, this will include, but not limited to, the first one is blood collection tubes, non-sterile gloves, needles or syringe, tourniquet, alcohol, cotton balls, blood specimens labels, and the lastly is sharp containers. Step 2. Prepping the patient. Once you have the necessary supplies, it's time to ready the patient. First, introduce yourself and ask for the patient's full name. Second, double check that the patient's name matches the name on the lab form. Third, ask if the patient has any allergies, has had any issues or complications during previous blood draws. Fourth, make the patient comfortable in you sense any anxiety or fear. Fifth, ask the patient to extend their arm and place in a clean towel or paper underneath. And lastly, explain the blood draw procedure and get verbal consent. Step 3. Locate the vein. With the patient's arm extended, inspect the antecubital fossa.
Look for a visible or good-sized vein, which will typically be the median cubital vein. This vein should be clearly visible before applying the tourniquet. Finally, apply the tourniquet 3 to 4 inches above the venipuncture site. And here's the tip. Keep in mind that opting for the basilic vein increases the risk of damaging a nerve or artery, and it is typically more painful. Mas masakit pa sa iniwan ka ng jowa mo. Step 4. Prepare your hands. Proper hygiene is essential for safely performing venipuncture. Be sure to wash hands with soap and water and dry with a clean single-use towel. Depending on workplace procedure, you may be able to clean hands with alcohol rub if they are not visibly contaminated. After cleaning your hands, you may now put on non-sterile gloves. Step 5. Disinfect site. It's important to disinfect the site before drawing blood to reduce the chances of contamination. Cleanse the site with a 70% alcohol swab by starting from the center of the venipuncture site and working outwards, covering roughly 2 to 4 centimeters. Be sure to allow the area to dry to reduce the risk of contamination. Be sure to not touch the disinfected site. If site has been touched or contaminated, repeat the cleansing process. Here's the tip. Use alcohol to disinfect the site instead of povidone iodine to reduce the chances of false lab test results. Step 6. Draw blood. Perform venipuncture using the following steps. Place your thumb below the venipuncture site to anchor the vein. Be sure not to touch the venipuncture site or you will need to repeat the cleaning process. Have the patient ball up their hand, form a fist. Puncture the vein quickly in at least 30-degree angle or less. Once the blood has been collected, first release the tourniquet. Be sure to do this before removing the needle from the vein. Slowly withdraw the needle and gently apply pressure to the puncture site with a clean gauze or cotton ball. Have the patient hold the gauze or cotton on the site with the arm extended. Step 7. Fill tubes. When collecting multiple tubes of blood, it's preferred to use evacuated tubes with a needle and tube holder which allows the tubes to be filled directly. However, if that's not available, you may use a syringe or wing needle set. Be sure to place the tube into rack before filling. Press the tube stopper with the needle applying gentle and steady pressure. Be careful to not press the syringe plunger to reduce the risk of hemolysis. If the tube does not have a rubber stopper, inject the blood slowly into the tube to minimize pressures and again to reduce the chances of hemolysis. Invert the tubes containing additives for the specified number of times by your lab. Important, be sure to follow the correct order of draw to avoid cross-contamination of additives. Step 8. Complete the procedure. Discard the used equipment into a puncture-resistant container, typically a sharps container. Items that haven't touched blood may be discarded into a general waste container depending on a state and or local regulations. Double check that the labels and forms are completely and accurately filled out. Perform a check on your patient by asking how they feel and checking the insertion site to confirm it's not bleeding. Thanks the patient and let them know that the procedure is now completed. And lastly, clean hands using the process described in step 4. That's all.
먹으리 아니과 가까운 게 그냥가 왜들 그래 서럽게 Maria 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 빛나는 밤이야 날 괴롭히지 마 Oh Maria Maria
napansin. So, tapos na pala tayo. So, hanggang dito na lang po ang aking presentasyon. So, don't forget to react, comment your number para matawagan ko kayo kung gusto nyo ba magpakuha ng dugo sa akin. Char! And don't forget to share na rin po. So, ako nga pala si Jewel Amelardi Port, your future RMT or Registered Medical Technologist. Boom!